Care Services, because there's no place like home.
Legends 100.3. It's a South Florida Saturday morning. It's time once again for Limitless Health Horizons, brought to you by Horizon Care Services. Horizon Care Services, excellence in private duty home care. And I know we talk about that on this program a lot, but this morning, Andrea Albertini, who of course is the co-host of this program with me and one of my favorite people, was telling me a story that really shows the excellence of that care and just how much you care about the people you provide care for. And it was just, she was telling this story and showing me these pictures, and it put me in such a great mood. And we're going to get into that and explain exactly why, because it's certainly not anything that I've ever seen from any other company. And that's the thing about Horizon Care Services. Excellence in private duty home care, really seeing the people who need their services as people. And then that got us at, well, there's so much to discuss today. Andrea Albertini, founder and owner of Horizon Care Services. How are you?
I'm good, Mike. Good morning. Good morning, everybody. Thanks for joining us this morning.
It's always great to have you here. And write this phone number down, Horizon Care Services, 561-776-7757, 561-776-7757. And the website is horizoncareservices.com. And, we've talked about your reviews. We've had some of the people on the air before who have used Horizon Care Services, but you were showing me pictures from someone who was celebrating a birthday. And not just anyone, but someone that you provide services for.
Yeah. So, Mike, we provide, private duty and home health services from Hollywood, Florida, all the way down to Port St. Lucie.
Right.
So we have a big, broad of area that we service.
Massive area.
And so a lot of the clients that lives between usually, between Boynton and, Stewart, they were around, this area, which is near the corporate office, is we bring them into the office and we buy them a cake and we celebrate the birthday with the staff and their caregiver.
That's so cool.
And the ones who doesn't live around corporate office, then usually we go to their home. And, when we get a cake and balloon, we'll send flowers to them. We celebrate their birthdays with them.
Nobody does that. I mean, that is so cool.
Well, they're part of the family. You got to remember, they came with us for long-term care. We are the extension of the family. We are with them every day, 24 hours a day, 7 days a week.
Yeah.
So we got to make their life just as special as they would family would,
I mean, that sets you apart so much, because looking at those pictures and looking at that woman who I believe was turning 82 years young.
Wasn't she beautiful?
So, and her... Like, it looked like a family picture.
Yeah, she's beautiful.
With the caregivers and the staff with her together, it looked like a family picture. You had that vibe, you had that feeling, you had that love for her, and she had for everybody else there.
Yep. And she kept saying, I love you guys. I love you guys. Thank you so much for all you've done for me. But you got to remember, our care also involved grooming. So, we get their hair done. We help put their makeup on, their jewelry on. They always look clean. They're always decent. They always have a shower. They always, a bath. So part of our care is making sure that our client live the best that they can be. Just because they need our services doesn't mean they're not going to be the way they were before.
Right.
They need us. You saw how beautiful she looks.
Yes.
Caregiver does her hair.
Great.
Yeah, makeup.
I noticed it.
The red lipstick.
Yeah, I mean, she was
cute.
She was a woman celebrating her birthday.
Yes.
And
82. God bless her.
And celebrating it with what looked like family.
I just can't say her name in the air because I don't have an authorization to do that because of HIPAA, but yes.
I can tell you, I saw the picture. She showed them to me. And that sense of family. And I think about what it must be like if she has children, grandchildren, who want to make sure she's okay. To see those pictures and you can see what she's feeling in them.
Yeah.
And know that she is in the best hands. Know that she is really loved.
Yes.
By the people that are providing her care, Andrea.
Yep. It is very important, Michael, to just choose the right agency for your loved one because, it's not, home care has to be home care for everybody is like, oh, whatever caregiver is available. Oh, yeah, well, we got Mrs. Stein or Mrs. So-and-so, whatever the case may be. Right. Oh, we have so-and-so available. That's not how we do things. We do personality match. Right. We want to make sure we pick the right person for you. We make a list of all the wishes, all the things that you did before.
Oh, I love that.
And just we try to get you to be able to have the same life you had before with assistance.
Right.
You know what I mean?
Yeah.
So you don't have to stop going to the crevice center or going out for lunch with
right,
your
seeing
friends.
Movies and dining out and all that,
Yes.
taking walks,
Yes.
whatever it might be.
Yes.
And I mean, to me, that's the difference, Andrea, between services that help people to survive and services that keep them thriving.
Yes.
And that's what I saw in that picture. That is a woman who is thriving with her caregivers.
Yes.
Yes. And that's what you find at Horizon Care Services. It's why it's so different. I mean, a lot of businesses can say we see you like family, we treat you like family. Horizon Care Services, you walk the talk, and it comes from the top down. Because I know you very well,
Yeah.
and I know that that's how you treat everybody. That's how you care about
Absolutely.
people.
We were talking about it today with actually a client of mine, and she says, "I love seeing you." And I said, "I love seeing you." She goes, "I've been seeing you for 2 years and sending you patients for 2 years. And honestly, I have never in my life used a company like yours. And I am so grateful to know you. I'm so grateful for what you do." And she was really, I said, "Thank you so much for saying that. It means a lot to me, But I do put a lot of money into my employees. I do a lot for my employees.
Oh, yes.
I do a lot for my caregivers. They don't just get their salary. We do employee of the month. We do caregiver of the month.
Right.
If they are in crisis, we come through for them. Whatever they need. I mean, we paid for funeral before. We donate money to help the body goes back to Jamaica. I just told you about the loss we had last
because
week.
that loss, it hit you like a loss. Like that was not just, we need to find another caregiver. That was, wow, a member of our Horizon family has left us.
And we never had a caregiver that passed away on us ever before.
I remember because you came in and I could tell something was different.
Yeah.
But that's you, and that's top-down management. That's the example that you provide, and that's the care that you provide too. Again, it is like a family, and you can learn more about all of it by heading on over to horizoncareservices.com, horizoncareservices.com, or calling 561-776-7757. And that also is the importance of working with an agency and the right agency, as opposed to just someone that may pretend to be a friend or someone that who's not up to the task and may mean well but not know what they're doing.
Exactly.
Or people who may pretend to mean well, which, sad to say, it's all over the place.
It is all over the place. And, I don't mean to bash franchises.
Sure.
But franchises are usually purchased by people who are not in the healthcare business, who just realize that they can make a lot of money on the seniors. And that's not me. I've been in this business for 40 years. I'm 58 years old.
Yeah.
I love this business. It's my passion is this business. And I started Horizon from scratch with nothing. I mean, it was just my husband as a CFO and one person, Iona, was my first administrator that was doing intake, HR. And I was out there just writing chart review and bringing patients into the company.
Right.
And I was on call for 2 years, 7 days a week.
24/7.
24/7.
Yep.
So I know what my employees go through on a daily basis. So that's why I appreciate them. Am I always doing something for them and for their children? I'm always giving back to my employees. And I think that's why I have such a loyal employees,
Sure. Well, you give back to them and they pass it on.
Exactly.
It's being paid forward to...
They work for me because they love me. They do the wonderful work because they see the love and passion that I have for our seniors.
I see it all the time, and they share it too, because I know how selective you are when it comes to hiring caregivers.
Yes.
I know I know what you do with that.
Yes.
Now, when it comes to really the opposite effect of that, hiring like off of the streets. How are people approached by that? What are the things to look out for?
So you have one of the things that has been happening for a long time, not just in the state of Florida, but all over this country, is sometimes a client is in a hospital, and then you have that little aide that runs around. Oh, Mrs. So-and-so, if you need any care at home, I have a friend, or I have a sister, or I have an aunt, or I do part-time home care.
Sure.
You don't want to do that. You don't, believe me, you don't want to do that. You want to go through the agency. An agency may cost you a couple dollars more,
Sure,
but it's going to give you the best care. Because here's the other thing that has been happening is they say, oh, yeah, I'm X amount of dollars. And then once they get you and you become... you become
you're dependent on them.
Dependent to that person.
Yeah.
Well, guess what? Then she can charge whatever she wants, whatever he wants.
Yeah.
That's number one. And number two, do you have background check on them?
Right?
You're going to be sleeping with somebody that you have no background check, has nobody to be. Who's going to account for that person?
Are they insured? I mean,
Are they
what's
insured?
the lawsuits from that? There are people, sadly.
Well, forget about that. They can stab you to death while you're sleeping.
And
I'm just saying.
And the thing is, that's not a fantasy. That happens.
It happens. And this is the scene. This is what's happening, which I call crisis and victim of extortion.
It really is
with our
extortion.
seniors.
It really is.
Yes.
I mean, there's enough out there with online extortion. There's enough out there with scams.
Yes.
Without bringing it right into your home.
Because there's nobody to account for.
Right.
We do 3 background checks.
Yeah.
We do fingerprinting to make sure that person have no criminal history anywhere.
Right.
Liability insurance, workers' comp, we're bonded and insured. And plus, we vet our people. The people that have working for us are people that I would put in my own home.
What bigger endorsement could there be, really?
Right, which they have been in my home.
Right.
When I had surgeries before.
It's, knowing that also really shows the loyalty that goes both ways. And like you've said, you've had caregivers there since the very beginning. In fact, the majority of your caregivers have been there since you started.
Yep.
Horizon Care Services.
Yep.
That loyalty, that quality of care, that experience, that love that goes in all directions. There's no other company like this.
Yes. And and people talk about it. I can't compete with Horizon because I know the kind of care they have. And you got to remember something. This is very important for the listeners. You don't have to need long-term care to use Horizon Care Services because you got to remember you may have a hip replacement, a knee replacement,
sure.
Or you may have cosmetic surgeries. You're going to have a mummy makeover or, you're going to have a facelift or whatever the case may be. And we even do a well mommy baby. Usually we have a nurse that takes care of somebody who just had a child.
Wow.
So we do that too. So, we do everything. We take care of, Down syndrome children. We take care of autistic children. We take care of, people who are on wheelchairs. It doesn't, you don't have to be a senior to use Horizon Care Services.
And that's a big misconception. So I'm really glad you addressed that because things happen. People have accidents. Yeah. I remember, when I was a financial advisor before I got into this, and we talked about long-term care insurance and everything and disability insurance, just different kinds of it all. People never really seem to consider what happens if I just get sick? Mm-hmm. What happens if I have an accident and I'm on the shelf for 6 months? They need that care then, and Horizon provides that care as well.
Absolutely. We have a 45-year-old attorney that's got on a car accident and, he's in a wheelchair. Mm-hmm. So we have younger people.
Right.
And we have the short-term people as well.
Sure.
So a lot of clients come to us when they start getting chemotherapy and they're very weak.
Right.
And they're very sick and they just need somebody there to make sure they're getting their medication, they have their fluids in, they're eating, something. You gotta have somebody with you.
Yes.
So we do that too. And sometimes also short term, once you're done chemo, then we're out of the house, So there's a lot of short-term stuff that we do. And a lot of our clients, when they do go in a hospital for procedures, such as knee replacement, hip replacement, or a cardiac or heart or anything like that, they call us. We put a caregiver with them. They stay with them bedside until they come home. So we do that too.
The scope is so wide when it comes to that because I think people think, honestly, and just not to put too fine point on it, I think a lot of people think long-term care, and they kind of associate that with end of life. And
What it's not. It's a quality
not
of life.
always the case. It's
Right.
a quality of life thing. And
Life enrichment. Remember we talk about that?
that's exactly it. And
Yep.
that's what you do. It's what your caregivers do. You can learn more by checking out horizoncareservices.com, horizoncareservices.com, or by calling 561-776-7757. I want to bring up one other point here. And, we talk about caregivers. There's a lot more to it than setting up prescriptions, than just being there to make sure someone is there. You have skilled nurses as well. So when there are people who need more complicated help, you've got the people that can do it. Let's talk a bit about that.
So we have we also provide registered nurses around the clock because we do trachs, vents, IV,
Oh, wow.
wound care. We do anything, injections.
Sure.
So it doesn't matter. You can be at any age. You don't have to be homebound. Like if you need a B12 once a week, if you need your insulin, insulin
Sure.
shots or whatever you need, so we also go from doing just a visit to also do hourly. So we have a lot of patients who, they wanted to have an RN with their loved ones. Sometimes they want to have an LPN, which is a little lower.
Sure.
But they do
Licensed
the same
practical
thing.
versus registered.
Exactly.
Yep.
But they do a lot the same
Oh, yeah.
things. Not everything. Like if you really, like we have patients who are very, very nursing home material, but they're
Yes.
not in a nursing home,
Sure.
then we usually have a registered nurse. Those are your
Absolutely.
trachs, your vents, patient who's on a vent and have a trach.
Right.
Those are the clients who actually have the RN around the clock.
But what this shows me again is that whatever the situation is, from the mildest to the most severe, if people want to be in their homes for this, Horizon Care Services has the people and the services to give them exactly what they're looking for.
Absolutely. Anything and everything. From senior placement, we talk about that all the time.
Yep.
From geriatric care management. And we're doing an amazing job with Hope and Jamie from Guiding Light Care Management.
I can't say enough about them.
I
They're such
just
good
love
people.
them.
They're the best.
They are the level of professionalism. Actually, I had a personal experience with Jamie, the owner of Guiding Light Care Management. Last week, that it was my personal experience with a member of my family, and it was pretty incredible. I was flabbergasted. So she's a social worker, and she used to work for the JCC,
Oh, yeah,
the Jewish
sure. Know it well.
Family Services.
Yep.
So her background is amazing, and so we work along with her. And, and everything else that we do, from our med management, to the best pharmacy who delivers your meds and everything else.
And, I want to talk about that for just a minute, because we've talked about it in the past, but I really think it bears repeating, because I think about my parents, and I think about all the different medicines that they were on. I think about those the little pill reminder deal that they were in. We'd set it up at the beginning of the week with 40 different bottles with these different lists that were always changing from this doctor and then that doctor. And then let's adjust this. And wait, what does that mean for this? And this one's at this pharmacy and this one's at this pharmacy. It was a maze, Andrea.
I know.
I was about the only one. And one of my sisters and I, we would go there and sort the pills. But my dad, he liked to do it for my mom. And I get why, but sometimes I had to go in and fix again afterward. And it would take him an hour and a half to do. And it was just, there was a lot of stress around prescriptions. And, Horizon Care Services really eases that.
Well, we have the med management program, and what I want you to understand is you don't have to be elderly, and you don't have to be homebound, and you don't have to be in our services for long-term care for you to use the med management program.
Right.
It can be of any age.
Just right
I'll
there.
tell you, 5 years ago, I had a really bad case of respiratory infection. I thought I was going to die.
Okay.
And I came home with so many prescriptions, from my pulmonary doctor, from this, from that, from the, and I sent it to my director of nursing, okay? And she looked and she goes, she's amazing. Believe me, she was a discharge planner and Good Samaritan and everything.
Wow.
And she goes, I'm going to tell you something. This is very, very complicated. And she had to call my doctors to get everything clarified and put the whole entire plan together for me.
Wow.
Because whatever the doctor sent on that discharge planning order was so confusing that not even her
she couldn't make heads or tails of it either, huh?
No. So she had to call my pulmonologist, my primary care physician, and my ENT to say, what is this? Can you help me put this together? So, and you remember this was like 5 years ago. How old was I? 54?
Yeah.
I mean, look, you don't have to be elderly for you to be confused about your medication. You don't.
I was in my late 30s, early 40s, and it was confusing for me to try to help them.
Yeah, yeah. So people here need to understand that if you just need help with your med management, we can come to your house and organize all that. Either you're in a facility, you could be in assisted living, you could be independent living, you could be in your own home.
It's almost really, it's so funny to think about, but it's almost like a list of what you don't do would be shorter than a list of what you do.
For sure.
For
sure. We cannot even put all that in the brochures.
Oh,
because
no way.
You can't, and again, like you talk about it all the time. Our care is so customized to your needs.
It really is. Yeah.
We get calls sometimes that somebody's going to have surgery over in Miami.
Okay.
Our caregiver stays with them the whole entire time they're there. They're going to have surgery in Tampa. They're going to have surgery whatever. They're going to Moffitt Cancer Center, wherever they go. My caregiver goes with them and stays with them, So it's just so much. I mean, sometimes they call us because, mom has to go to the dentist and has to have a tooth abstract or whatever the case may be. Our caregivers stay with them. So it's just so, our care is so broad. You just tell us what we need. Tell us what you need, and we'll provide.
The peace of mind that gives to family members, especially children who live out of town or in different states, knowing that the care and the love, once again, and that's a word I keep going back to, but it really is exemplified. Yes. Knowing that the caregivers really do come to love the people they work with.
They really do.
And vice versa.
Right. And Rebecca is amazing.
Oh, I love Rebecca.
Palm is amazing.
Yep.
They really care about our residents, our patients, and that's really important for us.
It's always so interesting to talk with you versus other people who are in similar businesses, because with you, it comes from a passion.
Oh, absolutely. Absolutely. Remember, we talk about my story.
Yeah.
And we'll talk about it again one day with
one of these
our
days.
Listeners. Yes.
Because, right now there's about 5 minutes left in this 4 minutes. And it's not enough to get into that story.
No.
But it's deeply personal for you.
It is.
And you can't say personal without person, right?
Yes.
And that's how you see every person that is doing business with you, whether it's short-term, whether it's long-term, whether it's going to be in-home, or whether you're referring them and trying to find a different facility for them, whatever it may be, you go and your company goes just by virtue of who you are and the lessons that you teach so far above and beyond what they're going to get anywhere else.
Oh,
There's
no,
nothing like
absolutely.
It.
Remember, I was part of this community 3 years before I opened Horizon.
Yeah.
So I knew what this community needed, and I am that level of care for our residents, for our community seniors, for sure.
And it just takes it. That really is what it takes. Again, it's the difference between surviving and thriving. One of the things that always really does hit me is there are people out there who don't mean well, who may be looking to scam or extort. There are also people who do mean well. There are family members, friends who say, listen, let me help you with the care. And they may be coming in with the purest of motives, Andrea, but that doesn't mean that they're capable of this.
I know that for experience.
Yeah.
It's not easy for us to be a caregiver.
No, it's not.
It's not. No, you're too close. When you're too close to your loved one and you are a caregiver, it's one, I think, one of the most difficult thing that you can go through. And sometimes you don't realize the weight that's on your shoulder because you attach emotionally to that loved one,
so tightly.
And it's very, very difficult and can really hurt you physically and emotionally.
Look, in cloud common sense. Yeah. And I've seen relationships deteriorate with family through that. I've seen friendships end because I thought you said you could do this. Well, I thought I could. Well, it's a more important situation than something you thought you could do. Health and life is at stake.
That's why you need training. That's why you
need the training, the licenses.
Yes,
I've seen
you need to
friends
have that.
sued and sue families. And it's just because, again, they may be meaning very well at the beginning, but the
They all do.
undertaking is not what they're ready for.
It is not. It is very, very difficult. And I don't wish that, I think that if you all could afford to get care for your loved ones, do that. And again, everyone should start life planning. Life plan. You're 40 years old, start life planning.
Yeah.
Buy yourself long-term care insurance. Start planning for the future because we are living longer.
We are.
Okay. And we are living healthier.
Yeah.
And, and people are not dying as fast as they used to in the past.
Yes.
So you got to plan because the cost of long-term care, no matter what, is very, very expensive.
Yeah. And it's not going to go down
No, it's not.
anytime soon.
No, it's not.
That really is what it's about. When that care is necessary, you want it to be with the people who are going to celebrate your loved one's birthday.
Yes.
Bring them that cake and have that loved one continually telling their caregivers, I love you.
Yes.
That's what you need. That's what Horizon Care Services provides. And that's why we have Limitless Health Horizons here on Legends, because the help is there. When you need it, it's time to reach out. 561-776-7757 is that number. 561-776-7757. And the website is horizoncareservices.com. Excellence in private duty home care. They walk the talk. And Andrea, I know you lead, and that's how it works.
Yes.
And as always, I mean, it's again mind-blowing that we're out of time again on this program, but we are.
We always are.
We always are. It's just like, well, we're just having a great time with the conversation, feeling everything so deeply, but it's what it's all about.
Yep.
And reach out, horizoncareservices.com, 561-776-7757. When you need it, if you know someone who needs it, if you just want to learn more about it, that's the way to do it. Reach out, learn more. Andrea is the owner. The team is just fantastic. And it really is limitless, and that's why we call the show this.
There we go.
I love it. HorizonCareServices.com, 561-776-7757. Mike McGann, Andrea Albertini, and you here on Limitless Health Horizons on Legends 100.3.
Happy Saturday,
Happy
everybody.
Saturday. Big time. Stick around.
Horizon Care Services, because there's no place like home.